All right, welcome everybody. My name is Courtney. I am the practice manager for Growing Bones Pediatric and Neuromuscular Orthopedic Institute here in Dover, Delaware, and I am joined today by Michelle Flores, pediatric physical therapist in Los Angeles, California. Today we are going to be talking about problems in the overhead throwing athlete. Before I get started, I wanted to invite you to post your questions in the comments box, as we will have a little brief Q&A at the end of today's session. And then Dr. Justin Connor will actually be doing a follow-up webinar live next Wednesday, the 4th, to answer some more of those questions in more detail. He extends his apologies. He couldn't be here with us this morning, but he will do a follow-up with us next week. So without any further ado, Michelle, let's go ahead and get started in talking about some common problems we see in our overhead athletes. So it is spring season, spring sports season, and some of our athletes are returning to sports for the first time after the pandemic, or they're returning to a more robust schedule of activities. So tell us a little bit about some of the diagnoses and injuries you're seeing right now in your clinic out there in California.
Yeah, so I would definitely like to talk about how, now that athletes are starting to come back into their sports, there are common injuries that happen in the overhead throwing athlete population. So these diagnoses often are at the shoulder or the elbow. So there's this diagnosis called little league shoulder, which is a change in the shoulder bone, like at the growth plate due to repetitive forces of throwing. You could have shoulder strains, which is a tear in like the shoulder muscles, like the rotator cuff. You could have shoulder impingement, which could be when the tendons of the rotator cuff are pinched in between the two shoulder bones. You could have labral tears, which is a tear of the cartilage of the shoulder. You could also have like just general shoulder instability where the ligaments in the shoulder are a little bit more lax, causing like more like unstable symptoms. And then there's also at the elbow, the ulnar collateral ligament tear, which is a tear in elbow ligament. I'm not saying that like all children will end up getting like all of these diagnoses, but these are places where there could be diagnoses that could happen.
Absolutely. That sounds like a lot. It sounds a little bit intimidating to think about all of those different things that could happen to the athletes. I did want to remind everyone and make you aware that this video and all the resources that we're going to talk about today, all these different diagnoses, will be posted on our website, growing-bones.com, and the link for that will be in the comments. Okay, so let's talk about some of the exercise routines that you've put together for us, Michelle. Let me get into sharing my screen here so we can talk about the basic routine and why you created this and maybe who it's for.
Yeah, and so before we go through any of these exercises, I do want to mention that I think it is really important to make sure that we have a good flexibility routine just so that we make sure that we look into internal rotation of the shoulder, just because that is a big risk factor for some of these injuries. And we'll add those flexibility exercises later on. So the basic routine that I have here is a little bit is I would say if your child is experiencing pain, I would start there. And then if you are getting into your season, like starting in the beginning, I would start with the basic routine. So they're smaller joint exercises so that you can start working on building the skills so that we can work onto the advanced routine. So we have shoulder internal rotation and shoulder external rotation strengthening exercises, which help strengthen the rotator cuff muscles. There's the prone row, which helps to increase scapular strength and stability to help with like the wind up position, like motion of throwing. I have tricep extensions, which help with the follow through of throwing, and then wrist extension, which helps with grip strength, as well as to hold the ball and like control its release. So with our advanced routine, I would say that at this point, with the advanced routine, I would either switch out the basic routine for the advanced routine when the basic routine gets pretty easy, or I would add the advanced routine in addition to the basic routine. So the advanced routine has exercises that will require more muscles to recruit for strengthening of these ones. So I have these D2 extension and flexion patterns, And so with these ones, I just want you to make sure that you look at the position of the hand and where it is, because that is a very important like motion to get when you're working on these. And then I have shoulder internal rotation and external rotation at the 90-90 position, which is a very functional position for the thrower because that is where you're throwing. And then I have push-ups as well, just to help with like upper extremity strength and stability.
Awesome. I know that we're not to that frequently asked questions portion yet, but I already have a question about these bands, right? I'm noticing in both the basic and this advanced routine that we've got resistance bands. How do I know which band is best for my athlete or for myself? You know, I go into the store and I see all the different colors. There's yellow and red and green. How do I know which one to pick to make these most effective?
Yeah. So I would definitely try when you're going to the store, I would definitely try to get a pack that has like a few different kinds. And then when you get home and then you're like trying them out, I would like you to start with the one that you're able to do the full motion of the exercise and like you're not struggling to get to the end range, like you're able to do the entire motion slow and controlled. And then when you notice that, make sure that it's not too easy. I want you to feel some like type of muscle work. You should be able to feel like the muscle is working as you're going through these motions.
Okay, fantastic. And these both of these routines, are they geared towards preventative care or for rehabbing? Like if I've got an athlete who is a thrower and they've just experienced an injury, you know, would this be a good fit for them?
Yeah, so I would say for someone who has an injury, I would say start with a basic routine. With somebody that we're preventing, I would say start with the basic routine, and if the basic routine is pretty easy and like you've gone through all of the exercises and all of the resistance bands are too easy, then you go to the advanced routine.
Okay. And you know, how do I know if the soreness that my athlete is experiencing after practice is really soreness or is it pain and an injury? You know, how do I know when to start on this exercise routine?
For sure. So after strenuous exercise or exercise after a really long time of not doing physical activity, it's natural to feel muscle soreness. So typically, like the muscles are tender to touch or kind of burn slightly with the movement. Um, so the length of time really matters. So you may not feel the soreness like while you're doing the exercise, but like 6 hours or a day later, you might notice that like you're really sore in like the area that you worked that muscle. And then that soreness can last like 1 to 3 days. If you notice that the pain or ache seems to linger on for a few days, that could be like cause for concern to see a physician. And also, if you're feeling the painful sensations while you're doing the actual exercise and like you're noticing like it's very localized pain and like it makes it hard for you to finish like your entire like practice, you may have an injury at that point.
Okay. So I notice here that at the top of these exercises, we have some notes, you know, when in season, when to perform them, and when out of season. But how do we know when to stop doing the exercises, right? Am I doing these for 3 weeks? Am I doing these for 10 weeks? Am I doing these forever? Right? How do I gauge that?
Yeah. So, in order to keep the gains that are created, it's important to continue doing the exercises to help prevent issues. So, this would include before, during, and after the season. So, it would be something that you would continue doing, just to make sure that your shoulder is prepped for like the next season that you end up doing it next year.
Especially when we talk about that addition of flexibility and increasing that range of motion, right?
Yeah.
It all correlates and connects together. You know, so when we're talking about athletes and we're in that spring season right now, one of the questions that we have in the chat is it better to keep my child in one sport all year long?
I think it's best to allow for your child to try different sports during different seasons. It's important to allow your child to have time off between their sports to allow for their recovery. I think it's also so like throwing sports are very like one side dominant, whichever like their dominant arm is. And I like to just make sure that like we have our athletes in different sports so that they get to try using other parts of their body just to help strengthen in both ways.
Awesome. All right, I'm going to check the chat really quick to see if we have any new questions from those joining us. Thank you again for all of those who are with us live. If you're not with us live, don't worry. All of these resources will be posted on the website. Everything can be viewed again later. When maybe you don't need this today, but maybe you'll need it at the end of the season or before. As Michelle's saying, we want to be practicing and engaging in these routines year round so that we're ready to participate in these activities. We don't have any other questions from the chat. Michelle, is there anything else that you wanted to mention?
No, thank you.
All right. Well, hey, thanks for spending your time with us this morning and for giving us these fantastic resources. Again, we've got a basic and an advanced routine. We're going to add some flexibility to those and get those posted up on the website. The link will be in the comments. And again, drop your questions in the comments or shoot them over to practicemanager@growing-bones.com. So that we can have those questions ready for you and prep Dr. Connor when he comes in next Wednesday on the 4th. He'll be talking in more details and answer those questions for you. Thank you, everybody, and I hope you have a great day.
Thank you.